And welcome to the show, Dr. Shah. How are you doing today?
I'm doing well, Eric. Thanks for having me again on the show.
I'm glad to have you back. I wish we weren't talking about COVID-19 and we were just having a chit chat, but unfortunately, COVID-19 is still very much on the forefront of everything we're hearing about. And I know you have a lot of insight on amputations and COVID-19, and we're seeing a rise in cases where folks, while they battle COVID-19 and they're younger, they're losing extremities or being amputated. And most recently, Broadway star Nick Cordero, who we unfortunately passed on, he had a 13-week fight, but what really brought media's attention is during his fight, he actually lost his left leg. What is going on with COVID-19 and amputations?
Yeah, no, I think what happened with Nick is obviously a tragedy of epic proportion, and my heart goes out for his entire family, who have to deal with this. And it does bring up a lot of valid points worth discussing. Some of this, in my opinion, media has really missed the boat on. So, again, I wasn't the attending physician in this case, so I can't comment on the specific details, and look like there was a valiant effort made. But there are really two major issues, I think. One is COVID-19 and peripheral vascular disease, causing these blood clots and issues that COVID is causing by itself, as well as the treatment of COVID can also lead to that. But a second, bigger, major issue that I feel like no one's talking about is amputation. I haven't seen anyone in media bringing up the dire consequence of amputation that millions of Americans still go through every day. So, with COVID specifically, COVID is a hypercoagulable disorder, and it has caused issues with amputation by causing blood clots, which COVID causes in the arteries and as well as in the veins in the lower extremities, as well as some of the treatment that very severe patient of COVID requires a device called ECMO, which can perfuse the lungs, but this is a big bulky device, and it can also lead to pressure on the leg arteries and eventually can lead to lack of blood flow, causing the amputation. But to me, the more important issue is, we're talking about this amputation at a micro level, but I think at a macroscopic level, there are millions of individuals in the United States till this date living with amputation. And amputation itself is a bad news in terms of it causes tremendous impact on patients' livelihood, their longevity in terms of how long they can live, as well as the quality of their life. And it's a burden on them, their families, and the society in general. And people who have amputation, their risk of survival is as bad as stage 4 cancer, and no one even talks about it. So I think these are the two really major issues that should be brought to forefront. And I wish major organizations like Amputee Coalition and media in general would have taken the opportunity to raise awareness for millions of individuals in the United States who have peripheral arterial disease and have amputation and deal with this.
That's crazy. I didn't realize that the survival rate of an amputee is that of stage 4. I mean, I know several folks in the service that have been either involved in helicopter crashes overseas or hit by IEDs in combat, and they are amputees. And, I'll give them that. I have a good friend of mine. She attempted to climb Mount Everest. She made it to Hillary Step with missing her left leg above the knee. And she could have kept going, but everybody who was with her couldn't. So it's kind of crazy that she did that. But I know it is hard. The amputation, it costs a lot of money. It's amazing how these legs go together.
It's a huge burden. I mean, the average cost of amputation, once a person gets amputation, is $100,000 per patient per year, because they, large majority. I mean, the example you are giving is obviously phenomenal, and there are people who rise above any occasion, and they live to show, and I mean, going back to Nick's story, obviously, it seems like he fought valiantly with this. And there are examples like this, but large majority of the folks, the millions of individuals, over 200,000 amputations that people who go through amputation every year, these are diabetics, these are people with high blood pressure, cholesterol, these people have kidney disease, and they don't even realize that they have circulation so poor that they could lose their limb. So, again, amputation can happen in a more dramatic, rapid situation, like, the war veterans, or helicopter crash. But that's less than 20% of the amputation in the country. Larger than 80% of the amputation happen because of this disease progression, which is completely preventable, which is something that could be picked up by patients, by their healthcare providers, and by bringing attention, because the treatment is phenomenal and you can prevent 80% of the amputation. And yet people, even in 2020, go through these amputations. And again, as I said, more than 50% of them will not live more than 4 or 5 years. And those who get amputation, their likelihood of getting amputation on the other limb is like astronomically high, like almost higher than 10 times than any other individual. And obviously they don't have the quality of life. And right now, as you know, race in America is a big issue, right? Racial equality. And it baffles me when I see everyone from both the aisles, both parties talking about, racial equality and where do we stand. And I don't think these conversations are complete without talking about the racial inequality when it comes to healthcare in general, but especially when it comes down to amputation and diabetes and peripheral arterial disease. Because if you happen to be African American or a Latino or any minority, your risk of peripheral arterial disease and diabetes and amputation is way high. And we saw that in COVID. People who were of color unfortunately ended up having worse outcomes. So I think this is a lot of conversations are tied, and this story really brings it up to the forefront.
So let me ask you. So you say that this can be prevented. So let's talk about that. How do people do it? Obviously, the IEDs, those are different. You're right. I mean, there's only, I think, 24 million veterans in America as it is, so that it narrows it down. But obviously, there are healthcare measures that people can be taking. Not everybody has COVID-19, like Nick.
Yeah.
But we're seeing a rise. But how do people prevent it?
This is the crazy part. More veterans end up losing their limbs, not because of war or any like war-related injury. More veterans, I want to say 10 times more veterans end up losing their limbs later on in their lives because of peripheral vascular disease. So even amongst veterans, when we talk about amputation, it happens way more commonly because of these underlying risk factors, which again, as I said, are completely preventable.
It's bananas. So how do they prevent it? Let's just talk about that. Let's talk about prevention of amputation. So how do people do it? How, if you're watching now and you're like, crap, I have a lot of people we know in America have diabetes, or if you're worried about getting COVID-19, which it's spreading, and depending on who you talk to in what medical capacity, or you ask our friends on social media, which everybody seems to be an expert, not just on COVID-19, but civil rights and the military lately. How do we keep people healthy and to stay away from amputation being this, leading them down the road to amputation?
Yeah, so as I said, most amputations happen because of peripheral arterial disease, which is lack of blood flow to the legs. Very easy to pick up by simple testing. More often than not, just simple physical exam, checking people's pulses, make sure they have good pulses. So just seek attention. Early detection and screening is name of the game. So if most people think that they get leg pain because of age, I can't tell you how many times people come to us and say, oh, my legs are hurting because I'm old, or I have arthritis. Like 80% of the time, if they're diabetic, they do have circulation problem. And it's a problem that people don't think about it because it's not on their mind. There is not enough awareness about it. So most people think, oh, it's age related, it's diabetes causing some nerve problem, some arthritis. No, in reality, they have serious peripheral vascular disease. So talk about it with your healthcare providers, seek attention. If you have pain, discomfort, discoloration, if the legs have those blue-black spots, or the skin color is changing, or if they have open wound or an ulcer that's not healing. Oftentimes people get a little bit cut in the skin in between the two toes, and that's not been healing for like few weeks or few months. And that's what we call non-healing diabetic foot ulcer. Diabetic foot ulcer or non-healing ulcer is again a biggest precursor of amputation. Because these people with diabetes, they have critical limb ischemia, which basically is saying lack of blood flow to the leg. So in the heart disease world, we all understand heart attack. We all talk about heart attack because there is awareness about it. Anytime somebody has crushing chest pain, people immediately think they're having a heart attack, and they go either to their doctor or the ER and get attention. Same way, people don't think about the legs causing leg attack or a foot attack. But I always tell my patients, and whenever I'm trying to educate the referring, some of our primary care doctors, I tell them that think of a foot attack or a leg attack. You have a complete substrate based on your risk factor like diabetes, smoking, high blood pressure causing, this issue, and then you're waiting for a foot attack, which will come and will lead to potentially, very dangerous consequence like losing a limb. So get attention, get screened, just ask your healthcare provider, get the pulses checked, the blood pressure test of the leg. Everyone knows about blood pressure test of the arm. There is a very simple way to check leg circulation by taking blood pressure of the leg at different levels. We can check blood pressure at the thigh, at the knee, at the ankle level. And the name for that is called ankle brachial index, or ABI. It's a simple, very effective. Every insurance covers it. Even if insurance doesn't pay for it, most doctors will do. I mean, we provide free screening for any folks who need this ABI. It's a pretty straightforward, easy test, and it will pick up more than 90%. I want to say 96% actually, based on the studies, in terms of sensitivity and specificity to pick up disease. So that's why number one tip, if you ask me, is detect it. Talk to your healthcare provider and get this easy test. Number two, if you have an ulcer or wound that's not been healing, talk about it. See if there are simple, effective endovascular treatment. People think that if you have peripheral arterial disease, fixing it is a huge problem. You need to open, you need surgery and cut down. No, those days are gone. Nowadays, we can fix most of these blockages with simple catheter-based treatment that takes less than an hour in most cases. And you can fix these blockages, and this problem that has been going on for years and years, you can at least reverse it to a degree. And obviously, number three goes without saying is risk factor control. If you're a smoker, obviously it's not a good idea. If you are diabetic, make sure you get checked, make sure you are on all the appropriate medications, and obviously exercise. Exercise, eat healthy, and things like that. So prevention, early detection, and then seek treatment if needed.
I love that you say that. So let me ask you a question, because I've been reading some literature here, and it talks about the fact, and I was just thinking of myself when I read this a couple days ago, that a lot of doctors in primary care, they're not examining patients' feet as much as they should. A lot of people, I can't tell you that I've been to a podiatrist, but I can tell you I get a physical at least once a year. And I can tell you, yes, I understand. I learned in the military real fast that our feet are the cornerstone to our life. Trust me, it's why they always tell us to change our socks when we do long hikes. And I understand my feet are the most sensitive part of my body. My family makes fun of me because of this. I swear I end up on the ground if I stub my toe, but you can hit me anywhere else and I'm fine. But my toe, I'm done. I'm on the ground.
Yeah.
But why do you think so many doctors, how do we go? Do we just ask our doctor to examine our feet? I have a physical coming up. I'm curious because I want to know, because this foot attack, you're the first person to bring that to my attention. And it's concerning because our feet are probably, for most of us, our primary way of getting around.
Absolutely. I always say legs are the windows to the heart. And unfortunately, there is lack of awareness even among some of our colleagues, physician colleagues and healthcare providers in general also. So, we always say that rate of feet exam in the office, most doctors' office, is less than 5%. So it's an unfortunate, it's a sad reality. I think all the peripheral vascular disease societies are trying to raise awareness that everyone's feet should be examined, especially if you're diabetic, in each doctor's visit. Not only by examining, you take the shoes and socks off and feel the pulses, feel the temperature, see if there is swelling, edema, discoloration, all that stuff. It takes less than 5 minutes really, to do the thorough exam, and you can potentially prevent major issue. Legs are actually second heart. Most people don't realize your calf muscles, your calves are actually like a second heart, because it's what we call the calf pump, right? Heart is a pump. Job of the heart is to pump blood that goes from the heart to rest of the body. When the blood has to come back, the leg muscles have to push the blood back. So if you go back in the literature and look at the ancient Greek, who were the first in medicine, they call calf as the second heart, because that what pushes blood back to the heart. So legs are so vital to our heart health, our overall health, that it should be paid attention. So I think if you are a patient or a person and going to your doctor's visit, and if you have risk factor, 100% you're gonna mention that I want to make sure that you check for my circulation, check my pulses are okay or not, and if they're not, get tested.
Awesome. So let's talk about this. A lot of people we're talking about PAD or peripheral arterial disease, but a big misconception that I've been reading is that it only impacts the elderly, and we hear this a lot even with COVID-19. But we've recently heard from the experts, including the CDC and the WHO, that actually the age group is much younger for COVID. Is that the same for PAD or peripheral arterial disease? I learned a new word today, and I'm using it in a sentence just to be like you, Doc. I want to be like Dr. Shah.
It is getting more and more common, right? I mean, a lot of this literature, a lot of these statistics come from like older data, older trials. And back in the day, people would not, if you were in your 40s and 50s, you would not even get tested because the misconception is, oh, PAD only happens in old people, so there's no need to check for it. But in reality, we are seeing, and the lifestyles have changed. The stress level in younger people in their 40s and 50s has gone tremendously high. So we are seeing all the risk factors much earlier. People we are seeing high blood pressure much earlier. We are seeing high cholesterol much earlier. So we are seeing all this stuff. So, along with it, we are seeing peripheral arterial disease also very common. The cousin of peripheral arterial disease is peripheral venous disease, which is venous insufficiency, which is way more common. It doesn't necessarily lead to amputation. It can cause like really bad varicose veins, ulcers, swelling, discomfort, which is also not just a cosmetic issue. It's a major lifestyle issue. And we are seeing that way younger. I'm seeing that in people in their 30s and 40s even. So, these diseases are getting, definitely getting much earlier. Part of it is because now we have easy technology to detect it. So we are finding them faster and easier. Part of it is because our lifestyles have changed. Today's like 40 and 50-year-old are going through way more stress than, what people used to go way back. So, absolutely. And in COVID, we are seeing obviously that yes, if you're older with risk factors, your likelihood of getting disease is way higher, and especially the fatality is way higher. But even younger folks, unfortunately, like Nick, sometimes can succumb to this disease and get really rapid decline.
Yeah. So let's go back to that. So we talked about Nick, and obviously he lost his leg, and obviously ultimately lost his life to this. So I know that there's this going around, and I've read it several places, so I'm going to ask you about it. They say PAD is basically, some people believe it's not fatal, but clearly Nick proved that it is, and I'm not laughing, but there's always somebody out there that says something's more of a nuisance than fatal, and you're like, and then how are people dying from it? That seems more than a nuisance. Dying is not what I want to happen. If there's a way I can prevent it. So how do we change that misconception that people should be looking everywhere, not just the standard? The problem is, and I'm sure you see this, is WebMD is not the ultimate place to go when you have a symptom. It's like when you have a cold and you Google it, and you find out you could lose all of your limbs and you're not going to survive, and it's the common cold. What should folks do when it comes to taking this serious? I mean, number one, this is fatal, right? If you get these symptoms, you could die.
Yeah. So again, I think COVID is obvious. We are in unprecedented time. I think this is a rare time in the history, and I hope we can go over this hump. But symptoms have to be taken very seriously, and we are seeing that COVID is on rise in so many states. I live in New York, and I practice in New Jersey. And in these states, finally, after months and months and months, the curve is starting to flatten out. And even now, I tell my patients, my friends, family, do not put your guard down, because we don't know when the curve can go back again and when the second wave can come and hit us. So putting the guard down has never been good, especially in a current circumstance and situation. And I think you gotta do this safe practice. Seek attention. Nowadays, talking to your doctor is not that difficult. Apply common sense when it comes to prevention. Keep the distance and and all like the social distancing measures. I don't even want to go through it because everybody has gone through it. But if you develop symptoms, don't ignore it. Get tested. Talk to your healthcare provider. Get tested, because there is an off chance this could be COVID, because people sometimes think, oh, I'm young, I won't get COVID. No, that's not true. You could get COVID as a young person. Misconception is like, I don't know anybody who had COVID. I didn't get in touch with anyone. You have no clue, because right now the spread is community wide, and you could have caught it from somebody who was asymptomatic. So again, always go with the possibility that you as a young individual could possibly also have COVID. So first thing is, if you have any symptoms, stay away from others and get tested. And if you have COVID, it's okay. There's no reason to panic right away, but beware of the possibility that this could turn into something fatal very quickly. And it definitely should not be ignored. It definitely should not be taken lightly. We're not there yet.
Awesome. So let me ask you. This is the elephant in the room with anybody who's in the medical field today. This ongoing debate in our country. I live on the West Coast. I know New York has done a great job with this. Wearing a mask. It's huge. People fight it, but I mean, I think I've been one of the first people when I've flown internationally. I've worn a mask when I fly, just because number one, before COVID-19, we all, honestly, if you've looked aboard an aircraft and you thought that we weren't spreading germs to each other sitting like cattle in those airplanes, you're naive in the first place.
Yeah, germs are always there.
But there's a lot of people fighting masks, doctor. And what's your thought on that? Obviously, you're a medical professional. These masks do help. And if they keep businesses open, which is key, that way we could still go to the doctor, go to the barber, go to the grocery store and not infect each other. And clearly it is spreading. I believe as of this recording, we're at 130,000 Americans alone have died from this disease. Florida is in an all-out, like their numbers are tripling daily. Texas is seeing the same thing. New York and New Jersey, you guys are doing good. We're doing pretty well here on the West Coast. Some cities, I know California's been punished. How imperative is a mask? Because we hear people, it's just masks do help, right?
I think a regular mask is not protecting yourself, right? I think this is a perfect example that how we are all intertwined in this society and our fabric is so interwoven. So when I wear a mask, I'm protecting you, and I expect the same from you, that you wear a mask to protect me. And together, you and I wearing a mask, we are protecting our businesses, we are protecting our society, because we are allowing these businesses to slowly start, so I like this phased opening that most governors are doing all across the country, and I think you can debate and argue the timing of it, but we do need, businesses to function. We need society to start moving, especially, in healthcare, because there is a secondary crisis, for example, COVID brought, right, is those people who had, going back to our original conversation, those people who had peripheral arterial disease and vascular disease and heart problems, they did not seek attention because they were too scared to come to the office. And that has led to its own set of issues of not seeking attention early on. So the society sort of has to move on, especially when it comes to healthcare. We do need like non-COVID care as well. So wearing this mask enables us, by me protecting you and you protecting me. So I'm all for it. You can argue the merits of it, but I don't think there is any data that it harms anyone or it hurts anyone. And there is plenty of data that it actually does prevent the spread and germs. Now, COVID may change. Some people are saying it is mutated and it's less fatal than what it used to be. We don't have enough evidence for any of that. So until we have enough evidence and until the curve is truly flat in each state, each region, the guard should not, nobody should put their guards down. So I'm all for everyone wearing a mask.
I love that you said that, because you said something key that I think everybody should hear. And the problem is we don't have enough medical professionals on the air saying what you said. It's not helping you, it's helping others. Wearing that mask prevents, because we still see it. I was just talking to this with a guest earlier about the biggest problem we have is how many times, since January, you're a doc, so you obviously tell people to cover their face when they sneeze and, wash your hands and all these very simple things that people need to be told now in 2020, which is weird. I tell my teenagers, hey, make sure you wash your hands. That's something I've told them since birth. But we're seeing it more and more, and it's good that you brought that up. The mask is to help the masses. And, we have, obviously you're a guy who goes into surgery, so rocking a mask is part of your uniform of the day when you do it. It is something new for a lot of us to wear one all the time. But you see people, it's affecting my heart. No, it's not. You're not going to, I don't think anybody's going through suffering, and I see you laughing, so it makes me feel good that I know I'm right. You guys?
No, 100%. We wear N95. During the COVID crisis, even right now, right? Anytime we are doing any procedures, sometimes when people have these leg blockages, we are doing these procedures, and depending on the number of, I had a patient, for example, who had COVID and had complete clot of the entire leg, had just huge thrombus and huge clot. Perfect example. He was young. He was in his 50s. Perfect example that how COVID is causing limb loss, because he had huge blood clot. Luckily, he had his truly a foot attack. Luckily, we got him right away. And this is back when like hospitals were still figuring out how to deal with COVID patient when they need poor procedures or surgeries. And we had to make some phone calls and get special permission saying that if we don't operate on this guy right away, he's gonna lose his limb, and he's gonna possibly down the line lose his life. But right now he's gonna lose his limb. So we spoke with the hospital administrator. They allowed actually the entire team to do procedure, and this is like, I'm talking like March, early March. So nobody knew, like, but this hospital administrators had the balls to like basically allow this. And so this was unprecedented. We had to do this procedure, and some of this like huge clots can take a lot longer than our traditional procedures. So this was like a 3 to 3.5 hour case, and we all wore like N95 mask, and not just one, because this was so early on. We were all worried about it. So we put an N95, we put a second mask on top of the N95 mask, and we put a face shield on top of this. And now you're doing, and then you have a gown, like, and then you wear a lead because you're under the X-ray. On top of that, you have another gown. So we have like four layers, if you may. And you cannot break scrubs because we all had only one N95 mask. This is when there was a shortage of PPE. So we were all given only one mask. So you can't really break the scrubs during the procedure, anything like that. And we had to deal with it, and we dealt with it. And none of the team members in the operating room died. We were, it was difficult to breathe through the 3 or 4 layer of mask, but it's okay. You deal with it. And we not only like we were okay, we were successful in opening this blockage, and the guy we saved his limb and potentially his life from this. And these are the tough situations we are in, and we do it. And I mean, you're a veteran, like if you're in Army, you have to be tough. So when I hear people complaining about this, I kind of get it. I don't want to make fun of people. I mean, some people truly have underlying respiratory condition, then even a simple mask can make it a little bit difficult for them. But it's not that difficult. And, you don't have to wear it all the time. If you're not surrounded by people and you're not in a crowded area, you can take it off, So, but if you're in a crowded area, it's very easy to deal with.
Yeah. And I think that's one of the biggest issues, and then we'll wrap here. But a lot of people, you're seeing rallies and different stuff where social distancing isn't being maintained. People aren't wearing masks because they're under some misconception of the world that their Constitution, which, by the way, I've read the Constitution, there's nothing about masks in it. I checked. I'm 100% positive it's not covered in the Constitution, so wear a mask. It's funny how people are ignoring and trying to blame, say, 2 doctors, the one we see on TV all the time, the amazing Dr. Fauci and Dr. Drix. Here are 2 trained professionals telling you to wear a mask. They're wearing masks. You doctors are wearing masks. You're all like, it's not like you guys are in a gigantic club going, we're all in on it together. We're telling everyone. No, you're wearing it because you know the hard data. You've been to school. So I think the takeaway is wear a mask. You don't, like you said, you don't have to wear it.
I think what happens is some people are not seeing the dire consequence of this deadly disease the way we in healthcare get to see it on a day-to-day basis. And I think sometimes if it's not in front of your eyes all the time, you kind of like miss the big picture. But just because you can't see it doesn't mean it doesn't exist. So I think COVID-19 is real. Masks do protect to a degree. We are still learning more about it. We are gathering more data. So unless we have more evidence, more robust evidence, it's a relatively simple thing to do. And I think it allows the society to function, which I think is very important. Businesses can open, society can function, which reduces the other healthcare burden and like society burdens.
Yeah, I think you hit the nail on the head. We just wear your mask so we can continue doing stuff, so you can still go to your doctor's appointments, so you're catching these things. You're get your hair cut, your nails done, whatever you need to do. Go grocery shopping. I know New Jersey probably doesn't want to talk about eating in restaurants, but most of us still can do that, except in New Jersey. You guys messed up. Wear your mask. But I know in New York you can dine in. I know here on the West Coast a lot of us can still dine in restaurants. It's wearing masks. It's a pain. Trust me, I have teenagers. And it's one of those things that we have masks in all of our cars now because it was one of those things where you leave and forget. So it's something it takes getting used to. We're all not doctors, so wearing them all the time and being part of our day isn't used to it, and we're getting better at it, but obviously I want to thank you, Dr. Shah, for joining us today. This has been an amazing conversation that I think we need to have you back on maybe once a month, every couple of months to talk about what's going on because, number one, I never knew that your legs and your feet are the way to the rest of your body and how severe this is that a lot of people don't check. And again, I'm not kidding when I said no one has ever, like, hold on, let's check your feet when I'm looking at stuff, and I'm blessed with or cursed with really large calf muscles. So when you were talking about there's your second heart, I'm like, man, these things cramp up. I'm always flexing and stretching these things. I drive myself nuts. I blame my Peloton for that. But, it's good that you're bringing light to this. And I think so many people need to know. And I think Nick Cordero's passing really woke up people. 41, didn't have, I haven't looked at his medical records. Obviously, and you're not his physician. But, he was in pretty good health, according to everything I read. 13 weeks in the hospital. Within 2 weeks, he had already lost his leg. He never left the hospital. 13 weeks, he passed. So you brought a lot of good light to people. I hope people are taking advice. So where can people find out more information near you? Obviously, you're in New Jersey. So, folks can follow your website. Where should folks connect with you if they want to learn more?
Yeah, so once again, I do want to say my biggest regards to Nick and his family. Obviously, it's an epic tragedy. I hope media and all of us can take some valuable lessons from this in terms of raising awareness. I hope that we can keep talking about this huge issue. The amputation and peripheral arterial disease, and do not miss the boat on that. I'm available anytime, so thank you for having me on the show. Anyone has any question, can always ask me on our website. I'm also on all social media, and I'm sure the link will be there somewhere. So please, any questions, feel free to reach out. We'll love to be of any help, assistance, or any answers.
Awesome. Well, thank you again, Dr. Shah, for joining us, taking time out of your day to talk with us. I've learned a lot. If anybody else, I learned something, so I'll take that to the bank. So thank you again, Dr. Shah, and we'll be right back with our next guest coming up after.